My name is Allison Dahl, and I'm from Brookings, South Dakota, and I work at the SDSU Foundation as a Development Administrative Coordinator. She is newborn, so still kind of growing into her personality. Loves to stare around and smile a lot, which is fun for us, and loves our dog, which is good because he's a big Doberman that loves to lick and play. We had one nurse named Lacey, and she was absolutely amazing. We came in, she sat us down, kind of explained what the process was. We just weren't fully prepared yet for that. And she was with us in our room the whole time I had a lot of back labor, so she was really there supporting me and my husband and walking us through what was going to come next. Again, she was just exceptional. Evelyn was measuring small her whole pregnancy. We were in the 10 percentile or under 10 percentile most of the time. So every week we would come in for BPP tests, and then once a month we'd be coming in for growth ultrasound tests. So we were here every week, and every single time we had amazing ultrasound techs, and we had Dr. Harzma calling us every week, letting us know what those results were and explaining what our next steps are and reassuring us that Evelyn's okay and she's growing. She's just gonna run a little smaller than an average baby, and which was nice for us because since it's our first, we didn't know how to react to that or how that was gonna look later on or the effects it would have. We had a night nurse named Morgan who sat with us, and we couldn't get Evelyn calm. We couldn't get her. We just felt like we weren't winning, and Morgan took her out of the room for about 30 minutes, gave us some time to just get ourselves together. We were frustrated and overwhelmed, and brought her back in and said, here are 3 things I noticed that help: bouncing her like this, wrapping her like this, and we've been doing it ever since, and it's calmed her down every single time. The first 2 days after Evelyn, it was just a different experience. You don't know what your body's doing or how to relate to it anymore. And so those nurses really helped us walk through and told us each step, and this is what's probably gonna happen next, and this is how you recover from X, Y, and Z. And so that really helped us. And then going home, we've been on lots of walks, and it's been good. So my husband really wanted to be hands-on. He is an athletic trainer, so he's kind of in that medical field, and he wants to know every single detail of every single thing. And so he was reading every book you could find and asking every question he could think of. And to have Dr. Harzma sit down with him and answer every question, and then during delivery have Lacey talking with him and telling him the next steps and reassuring him that it'll be okay. So to have those resources and have people there explaining to Woody, my husband, as well, on what to do has really helped me because he's so much more hands-on now that he knows a lot, probably more than me most of the time with the books he reads. Every mom has a different situation, but we chose to breastfeed because we thought that would be best. We wanted to kind of help build her immune system, and we read that breast milk is a way to do that. It was extremely helpful, especially because Evelyn was born at 5 pounds and 13 ounces, so she's just a small baby, and we were nervous. We weren't sure how much I was able to breastfeed. She wasn't latching very well, so to go in there and have specialists who can sit down with you and talk to you and help you through all your frustrations and all your excitement. Even they'd celebrate us getting a half an ounce, which doesn't seem like a lot, but at the time it was awesome. And then my husband also got to come, which was nice, so they put us in a different room, and the specialist would come in and just sit down and talk with us and walk through the steps. And then she wasn't getting enough. She was losing quite a bit of weight, so we started pumping and then feeding with a bottle, and I brought my pump in, and they sat down and went through every single setting of the pump because I didn't know how to work it, and showed us how to work the pump and what would work and how to wean her off of a bottle if we wanted to go back to breastfeeding. And they've answered every question we've had, which is amazing. I would tell them 100% to come to Brookings Health. They're absolutely amazing. We have not had one bad experience. Every nurse and every doctor we've had helps us through any questions we have, helps us learn the process more, relates to us. And then what's amazing is we can tell them anything, and they'll remember it the next time, and they'll follow up with us. We're not just kind of forgotten or one of 100. Dr. Harzma especially made us feel like we are a part of her family and treated us the same way.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.